Spear Medical Education. I'm Eric, and today I'm going to be showing you quickly how to obtain a manual blood pressure off of a patient. So this isn't using a monitor, an electric machine. What we're using is a manual sphygmomanometer, or a sphig. We're also going to need a stethoscope of some kind to carry out this procedure. So our procedure starts how all procedures should. We explain to the patient what we're going to do, how it's going to happen and why we need to do it to get that informed consent from the patient. We want the casualty to be in as comfortable a position as possible, whether that's sat at rest, laid flat, or whichever position they're in. When we actually record the blood pressure, the important thing is that we document what position the patient was in at the time. So where they sit, this is the blood pressure and they were sitting, or this is the blood pressure when they were laid flat. So to get started, we apply our blood pressure cuff from our sphig around the bicep that we're intending to do the blood pressure on. Now we need to make sure that, for example, if the patient's got a one-sided amputation, so they've had an arm taken off on, say, one side, we'd use the other side. Or if they've got an implant, such as a contraceptive implant in the arm, again, we'd try to use the other side. If they've had a mastectomy, so breast tissue removed, we'd try to use the side where that hasn't happened. So try and find the healthiest side of the body, if you like, the most intact part that we can work with. What you'll have on your sphig is an arrow that says either left arm or right arm, or some might just say artery. If you've got one like this, where it says left and right, what we're aiming to do is make sure that that arrow, so for the left arm in this case, is over the brachial artery, which is running down the center of the bicep, like this casualty here. So we'll wrap that around the arm. And we need to make sure the arm itself is at heart level. So we don't want it too high, so we don't want it up in the air or sort of at this angle, and we don't want it too low either. We want it to be not working with or against gravity, but just at the level of the heart. So we've wrapped it around the arm, and what we're actually going to do first of all is identify the patient's radial artery. So if you remember, that's the pulse that's in your wrist here. So on this patient, we're going to find his radial artery. So at the moment, my arm's down on his radial artery and I'm palpating that, okay? So from there, I'm then going to, whilst keeping my finger on this pulse, inflate the cuff. So your sphig will have a pump on it and then a valve that releases the air. We need to make sure the valve is closed. With my finger on that radial artery, I'm going to pump the cuff up, and we're going to keep going and keep going and keep going until I can't feel that pulse anymore. So once my hand can't find that pulse anymore, I'm then going to go a further 30 mmHg, millimeters of mercury, which is how this measures things. So I've pumped it up, I've lost the pulse. Let's say I lost the pulse at 120 mmHg. I'm then going to pump it up a further 30 to 150. Once I'm at 150, confirm, or 30 above where I lost the pulse, confirm that I still don't have a pulse and release that air. So let all the air out. I'm going to give the casualty a full 60 seconds for their arm's anatomy to recover. So I've taken all of the air out of the blood pressure cuff now. Their arm's nice and relaxed, and I'm going to give it 60 seconds before I do it again. This time, I'm going to use my stethoscope. So just like you'd use them any other way, I'm going to pop the earbuds into my ear, and then my diaphragm, which is the large flat side with the acoustic face, that's going to go over the brachial artery, specifically in the crook of the arm. So this is the crook of the arm, so where the inner side of the elbow, if you like, where the arm bends. Settle it on the brachial artery. It's been a full minute since I did since I deflated the cuff last time. I know that if I pump this up to 150, I won't have a pulse. I will have successfully cut off the arterial supply beyond this blood pressure cuff. So I'm going to pump it up to 150, letting the patient know it's going to be getting tight on their arm again. And at 150, I'm listening through my stethoscope and I can hear no sound. I'm then going to use the valve on the side of the sphig to slowly release air. So as the air slowly releases, my needle will start to start moving towards zero. This needs to happen really, really slowly, because what I'm listening for through my stethoscope is the first sound, the first tapping of the artery. So what that represents is blood for the first time at that pressure successfully passing past the blood pressure cuff into the arm. So I'll be able to hear it now. So I can't hear anything. I'm releasing the air, and then I hear tap, 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 tap for the first time. I look at my sphig, and wherever that needle is pointing to, that is the casualty's systolic blood pressure. So that is that upper number. So I release the air, I can hear that tap, tap, tap. I look at my monitor, my sphig, and that tells me that their, for example, systolic blood pressure is 110. I then continue to slowly release the air until I can't hear any sounds at all. So at the point that tap, 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 tap disappears, that is then the diastolic blood pressure, the lower number. So for this casualty, let's say it was 70. The patient's blood pressure is then 110 over 70. So once I've got that diastolic reading, I release the rest of the air out of the sphig, and then remove it from the casualty's arm and document what their blood pressure was. So for this one, 110 over 70, and then document the position they were sat in. So again, in this instance, the patient was sat. Thank you very much for listening. Hope you found that helpful. Drop us a like and subscribe on the video. We're also on Instagram, and look forward to more content like this that's aimed at getting you that sort of that refamiliarization with some of your practical skills. Thank you very much.